Hello, I'm Dr. Gordon Johnson, and I'm a pathologist. A pathologist is a medical doctor that studies disease. As such, we examine human body fluids and tissues. Again, I said a pathologist is a medical doctor. Pathos means disease, and ology is the study of. First of all, I'd like to address the situation of becoming a medical doctor and what it takes. It takes studying and realizing you want to do this when you're young, so that you have to prepare yourself with mathematics, science. You don't have to be perfect at it, but be a good, average, hard-working student, and you can accomplish what's necessary. You will then go to college, and going to college requires taking certain admission tests and preparation. Again, if you don't have everything in order to go off to some big, fabulous Ivy League school, Palm Beach State College or a community college is where I started. So I recommend those, and those are fine. While in college, you will take necessary coursework to get into medical school, a postgraduate from college program. College is generally 4 years, although some take 5 years to finish college because of course requirements. Once you are in certain parts of the college years, you start to prepare for admission into medical school. Some medical schools still require the medical college admissions test, the MCAT, and also they require good grades. They require some commitments to society. They want to see what extra things you did while in college. And you will have, in addition, an interview for medical school. So somewhere along the third year of medical school, you will take the medical college admissions test, and that might be at the end of your junior year or your third year of undergraduate school. And then in your senior year, you will do the interview process, and hopefully you'll have the grades at interview to be admitted into medical school. So again, it's 4 years of college, and then medical school is 4 years. Now, don't be frightened by the 4 and 4, because once you get into medical school, which will be probably your acceptance will come in your senior year, you're already essentially on your way to becoming a doctor, because few don't make it at that point. So it takes a couple of 3 good hard years of work, and then you're more or less in the club if you plan right. Once you finish medical school, which consists of 2 years or so of very, very didactic or regular schoolwork with tests and professors' lectures or computer online programs, then the second 2 years of the 4 years of medical school consist of actually being in the clinics, doing so many months of pediatrics, so many months of obstetrics, that's delivering babies, and gynecology, that's women's medicine, so many months of internal medicine, just the generalized medicine of the body, so many months of surgery where you actually see and work with surgeons who are opening the body to do certain things and fix things. There also might be a psychiatry requirement. So you need to know those parts of medicine. The mind is very important. So all of those things, the surgery, the internal medicine, the obstetrics and gynecology, the pediatrics, and other specialties of medicine will be covered in medical school just a bit. Probably while in medical school, you'll decide what you're going to do. At this point, you might want to go into pediatrics or go into surgery or go into pathology, as I did. to go into surgery might be a residency of 5 years, 4 or 5 years. Specialized parts of surgery, such as orthopedic surgery, will certainly be 5 years. Neurosurgery might be 6 or 7 or more years. Cardiac surgery might be a regular surgery residency, and then more surgery just in the heart. So there are specialties within surgery: neurosurgery, pediatric surgery. You do the generalized surgery and then you go into the specialty field. Internal medicine, there are specialties or subspecialties of internal medicine. So you might do internal medicine, where you're an internist, the general doctor of adults, or you might do pulmonary medicine, which is internal medicine plus a few years of the subspecialty training. Then you might do hematology as well, which is internal medicine. Then you study the blood and cancer maybe. Then there's nephrology, so you'll do internal medicine and then study the kidney. Gastroenterology, internal medicine boards, and then you'll get boards in gastroenterology, or the study of the esophagus, the stomach, the intestines, and liver, and those organs. So in pathology, let's go to pathology and talk about its residency program, for instance. So briefly, in some of the other specialties, you might do, let's say, 3 years of internal medicine, then 3 years of gastroenterology to become a gastroenterologist. Well, also in pathology, there are 2 broad categories: anatomic pathology and clinical pathology. I have boards in both those types of pathology. Anatomic pathology is the study of tissues, surgical pathology. If your appendix comes out, that is anatomic pathology, because that appendix will be given to the pathologist to diagnose and look at grossly, as well as to cut it up and look at it under the microscope. The autopsy pathology and medical examiner's work, that's another branch of pathology called forensic pathology, where not only do you determine by dissecting the body a cause of death, but also a manner of death, whether it's accidental, suicide, homicide, undetermined, natural. Those are all manners of death. So that's another branch of pathology. The other parts of anatomic pathology include molecular pathology and biology, as well as cytology, the study of cells, pap smears, or different fluids from the body to determine if there are malignant cells or abnormal cells there. That's, in general, what we call anatomic pathology. In addition to anatomic pathology, there's also clinical pathology, another specialty of pathology. In clinical pathology, you have the blood bank, the part that deals with giving people blood, the study of blood to make sure that it's compatible so that you can give blood when someone needs it. There's human biochemistry, the study of all the chemicals within the blood, the plasma, the serum, all the different things that circulate within the blood. Another branch of clinical pathology is microbiology, the study of all the organisms. So bacteria, viruses, fungi, all of those, the COVID, all of that is under pathology. That's all part of the laboratory. And in addition, there's hematology, which is the study of the blood cells. So that's clinical pathology. And again, I said I have boards in clinical and anatomical pathology. To get boards in both take 4 to 6 years after medical school. But again, in residency and in medical school, in residency and in these fellowships, these specialty trainings after residency, you are getting paid. So It's not quite as debt-provoking and as ominous as it may seem. As I told you, in anatomic pathology, we look at slides. The person that prepares those slides is called a histologist. They generally have 4 years of college. They learn this trade. It's like an artistic work to make these slides that we look at under the microscope, and that is a field of medicine. The person that looks at the slides in cytology, the cells, to determine if they're malignant or not, before the pathologist does, is a cytologist. So that is a field of medicine called a cytologist. And the person that works in the general laboratory to do the chemistry, the blood bank, the microbiology, is a medical technologist. That, again, just like cytology, histology, is a degree, a Bachelor of Science degree. And it's generally 4 or 5 years to be a medical technologist. Now, what do they pay? Medical technologists make a good wage, which probably would be considered $70,000 to just generally above $100,000 a year. Also, the cytologist and the histologist would be in those same categories. So medical technologists, histologists, cytologists, and pathologists. The pathologists generally make north of or more than $250,000 a year. So again, that gives you an idea of pathology, molecular biology, what you can expect to make, these different professions that you can do, medical school, how long it takes to be a doctor, the fact that it's not so hard, because after about 3 good hard years, you're more or less in the club and things start to go your way. Don't worry about the paying for it. If you get into medical school, there will be money. Thank you. This is Dr. Gordon Johnson. If you have any questions, feel free to contact me.